Hey, my name is Nurse Grace, and I'm going to show you the proper way to insert a Foley catheter on a male or a female. First, you have to prepare the patient, so depending on whether they're a male or female, you might position them differently. After you've successfully positioned your patient properly, now it is time to open the kit. So you're going to go and get your Foley kit. It's going to look something like this. Barred latex-free center entry Foley tray. I have the label like this. What you're going to do is you're going to open it. I've already opened it up, but you're going to open it and then you're going to pull the kit out. Now the first thing you're going to do is find out which way the flaps are. You're going to want to rotate it so that the first flap that's on the top will open away from you. So if I turn it this way, I'd be opening it sideways, or if I turned it this way, I'd be opening it towards me. So the very first flap needs to be opened away from you. So turn it until that's the direction it's going to go. The reason being is you want to open it away first, because let's say you started, to the side or whatever, and then like maybe your last flap was away. Well, now everything inside is sterile, and as you're opening it away from you, if that's your last one, you have the potential to like lean over your sterile field or like have your arm or something brush it. So what you want to just do to avoid that is start with the very first flap going away from you, so that it's impossible that your last opening will be the one that's away. So first open away, right? Everything else is still covered, so even if I were to accidentally lean over and touch something, it's the sterile field inside is protected. So now I'm open towards me, side, side. And you're being very careful to just touch the edges because everything inside this packaging is sterile. So now I might kind of rotate it this way so it's more square. Now the next thing inside the kit is going to be your drapes. So I'm going to try very carefully to pick it up just by the edge, right, with my hands. You can wear regular gloves to do this, or you can have, your hands bare like this. I might probably try to put gloves on. I just don't have any extra lying around. You're allowed to touch this even though it's considered sterile just by the edges, and kind of shake it out a little bit and then pinch it by the other side. Now this is the drape that's going to be going over the patient's genital area. So I'll show you how to position that on the patient. The reason why we use this, let's say, let's move our sterile field over here just for a second. Let's say here's a patient's genitalia right here. This one's a vagina. So let's say we use our sterile drape to go over the patient's genital area. This solves a couple problems. Number one, it gives the patient a sense of more privacy, that they're like mostly covered except for directly what's going to be used. Also, it's helpful for like when you actually have your sterile gloves on. This is still considered sterile except for like the very corners that you use to pinch. You can rest your hand on it because it's considered sterile, and you won't be messing up your sterile gloving. So sometimes, depending on the situation, you might need to like put your hand on there for leverage or to hold some of your weight. And if you don't have anything to rest your hand on, that can be challenging. So having this, number one, provides some dignity for the patient and also something to rest your hand on. The next thing inside the kit will be another drape. Again, we're going to pull it from the edges and kind of shake it out to find the corners. Okay. Now you'll notice that this one does not have a hole. It also has a shiny side and a not shiny side. So the shiny side is going to go down on the bed. Now what I like to do is like put the drape between the patient's legs. So if the legs are spread, you can kind of just put it down between them with the shiny side down, and this creates a new sterile field over on the bed. So right now you might be doing all this kit set up like on a table, but when you go to actually put the Foley in, sometimes it's easier to move all of it over to the bed, right where the entrance is going to be, so you don't have to be constantly reaching back and forth. If you have a patient that's combative or not cooperative, it's probably not the best idea to put your sterile field in the bed because it could just go flying as they're flailing and kicking. But if you have a patient that's cooperative, it's a good thing to do. So put the drape down, only touching the edges, shiny side down, between the patient's legs, and then at this point, the next thing is going to be the sterile gloves. So to open up sterile gloves, I'm just going to move this temporarily out of the way. To open sterile gloves, open it like this. You can touch this. This isn't considered sterile because right now, as I'm opening and doing everything, I'm either not wearing gloves at all or I'm wearing just regular gloves that I'm going to discard. So if I'm wearing regular gloves at this point, I probably want to take them off so I can put on the sterile gloves. Okay, so now I'm gonna take this out, and mine came folded like this. So you open it up, and now you'll see that the package looks like this. What you're gonna wanna do is use touching only the very edge of this flap. So see, this is a flap right here, and there's a flap over here as well, and there's flaps down here. So to maintain the sterility of these gloves, you wanna open the package, really kind of just going under these flaps and really touching only just the very edge of it to open it. So, like something like this, under the flaps, open it up like this, and you might need to pull it open and crease it a little bit. You're trying your best not to touch the inside, okay? Then you're gonna do is you're gonna put on your dominant hand first. So you're gonna use your non-dominant hand to glove your dominant hand. So I'm right-handed. This is my right hand, okay? So I'm going to use my left hand and pinch the very edge of the glove. So you'll notice that the glove is folded over. I'm gonna touch it right now just to show you, but normally do not touch it because then you would make it not sterile. So it's folded in half right here. So this technically is the inside of the glove, and this is the outside. So like if it was unrolled, you know, so it's rolled in, okay? So I can touch the inside part of the glove because that part is going to be going on my skin anyways. So I can't touch here because then I'd be ruining the sterile field, but I can touch the inside part where it's folded over. So pick it up. I'm going to put my hand like this, scooping my thumb in, kind of put it on. Now notice it's kind of rolled a little bit, right? I can put my finger under my glove like this, kind of unroll it, because I'm only touching the inside of the glove, right? That's not sterile anyway. I can't touch the outside because now it's not sterile, but I can touch the inside and kind of help roll it down as much as possible. You know, to make sure that, you know, your sleeves are pulled up so that it doesn't accidentally touch the sleeves. So now this hand is sterile, okay? So now what I'm gonna do is going to make sure to use this hand to touch underneath the cuff this time. So the first time we used our dirty hand to touch the inside of the cuff because that part wasn't sterile anyways. Now we're going to use these fingers to go underneath the cuff because this is the outside of a glove that's sterile, and the inside is technically considered not sterile. So I'm gonna put my fingers under here, touching only the outside of the glove. See that? And I'm gonna use it to put on my non-dominant hand. So same thing. And notice I'm using my fingers to pull from the outside. I'm no longer able to use my fingers on the inside of the glove like I did the first time because that would be touching my skin and make it non-sterile. So you can use both hands to touch like this because it's just sterile touching sterile, so it's not ruining anything. So I got my sterile gloves on. I might have to kind of flick it like this to get it down because again, I can't go under. So now my hands are sterile and I have put on sterile gloves. At this point, I have to keep my hands above my waist. At any point, if I let my hands drop, I could have accidentally touched the table or brushed my legs and then be considered not sterile anymore. So from now on, I need to keep my hands above my waist and keep them within eyesight, just so I know that nothing has touched them. I can touch this in the middle because it's sterile. I can kind of just throw that out. I can use my hands and pull my sterile field back, right? Because it's still sterile, sterile touching sterile. I can turn it around. Now I'm going to set up the rest of the kit of what's inside. Now I'm going to show you how to set up the kit. So inside you'll see lots of different things. Let's bring it over here for you to see. So we've got a syringe of water or normal saline. We've got cotton balls and a tweezer, or you might have one of two things. You might have the cotton balls and a tweezer, or you might have swab sticks. So I've already opened up this kit, but you'll either have one or the other. So you'll either have this swabs like this that are like basically cotton balls on a stick, and there will be betadine inside the package. Or if you don't have this, you'll have cotton balls, a tweezer, and then a pack of betadine. So we'll either have one or the other, you won't have both, but I put both in this kit so I could show you both of them. You gotta be prepared to know how to use either one. So what you'll do first is let's pretend that we have the swab sticks. So what you would do is, rip open the swab sticks, and it's helpful. Notice that I haven't ripped it down far enough that you see the sticks sticking out. It's a lot easier if you rip it lower down. I can't do it very well, but maybe you can do it if you rip it open and then kind of, rip it open some more so that the sticks will stick out so it's easier to grab them. That's one thing. First thing you do, if you have the cotton balls option, the first thing you would do is get your cotton balls all in a pile. So kind of like that. You would rip open the betadine, which I'm not gonna do, it's gonna make a mess. And then you would pour the betadine all over the cotton balls really well. Okay, and then you would put that down. Another thing to do is if you're throwing stuff away, let's say I have a trash can somewhere and I want to throw my stuff away rather than just dumping it back in my sterile field. You have to go around your sterile field to throw something out, and that's more important when you get to the patient cleaning, and we'll talk about that. So first step, kit preparation. Open up your swab sticks and get them ready. Get the sticks out so it's easy to grab, or get your cotton balls aligned, rip open the betadine, pour the betadine over the cotton balls. So that's the first step. Next, you're gonna prepare the lube. So you might have two options when it comes to lube. You may have a syringe filled with lube. Be careful not to mistake it for the syringe filled with saline, right? The normal saline will have 10 mLs and the lube will probably have, maybe 5, it's not quite as much. It'll also have a green plunger and it will say Sterile Lube on it. So just be careful not to squirt your saline out. So if you have this plunger, what you're gonna do is just squirt it out into the little container spot made for where you put the lube. So you see that there's a little spot right here, a little pool where you can dump lube at. So you would do that, squirt the lube out, or you may have a packet of lube, in which case you can just open it like you did the swab sticks, right? And then put it to the side, okay, so that it's ready. The next thing that you would do is get your syringe of normal saline, and what you're going to do is you're going to connect it to the port on the Foley, which is underneath this tray. So I'm going to pick up this tray, right? I can put it over here since this is considered a sterile drape. I'm going to pull out my Foley and make sure none of it is touching anything. There we go. This is a cover for the tip. We want to leave that on as long as we can to protect it, because this is the part that's going in the patient, so it needs to be super, super sterile. So what we're gonna do is take off this lid, right? Take off the lid, you can throw it in the trash, and you're going to connect it to here, so that way later you don't have to try and do that with one hand. It could be really challenging. So right now you still have 2 clean hands and you can do that. Okay, so after those 3 things, betadine, lube, and connect the syringe, you have finished preparing your kit. Okay, next we're going to be cleansing the perineal area. So the way I have this set up right now is, let's pretend this is in the patient bed. Here's the patient's genitals. Right now we have a vagina. So their legs would be, hypothetically going like this, right? This drape would be between the patient's legs. So we're just imagining that there's legs on the outside and all our stuff is on the sterile drape in between their legs. All right, so now at this point we have our kit set up. We are ready to clean, okay? So what do we clean with? The betadine. So I'm going to use the tweezers and the cotton balls for this demonstration, but you could just as very well use the cotton ball or the swabs. I might do both. So first thing I'm going to do is make sure I'm on the right side of the bed, right? I'm right-handed, so that means I want to be positioned so that my non-dominant hand is going to be what's closest to the genitals. Reason being is because when I go to put in the catheter, I want to have my dominant hand being the one putting it in because it's easier to steer better, right? If I was on the other side of the bed, like over here, I'd be having to put the catheter in with my left hand and it's not as coordinated, right? So either that, or if I was, left-handed, for example, I'd have to try and do it backwards like that, and that wouldn't be fun. So just make sure your left hand is what's closest to the genitals and your right hand is just gonna go to drive in, if you're right-handed. Okay, so first thing you're gonna do is you're going to get your cotton ball. I just threw one on the floor. You're going to get your cotton balls, which are supposed to be covered in betadine. All right, and now you're going to establish your dirty hand. So my non-dominant hand is now going to be dirty the minute I put my fingers on the patient's labia. What I'm going to be doing is spreading the labia out. If you can see, the vagina is what's down here, right? And the urethra is the hole above. So don't be aiming for the lower hole. That's the vaginal opening. We want to go for the urethra. So I'm breaking sterile procedure right now with this hand. I'm just putting it back. Okay, resuming. Okay, so I'm going to use this hand to spread, right? And then I'm going to take my cotton ball betadine. I'm going to do 3 swipes, right? Once on this side, I'm not going to ever cross my field now because now it's dirty, right? Because I just wiped their labia. So I don't want to put my hand above here because what if I accidentally drop it? I've contaminated my sterile field. Or what if the betadine drips off onto the sterile field? Now the whole thing's contaminated, right? So after you do your swipe, you're going to reach around the sterile field and put it in the trash. Might be a good idea to have a trash can next to you over here. I don't like to have a trash can on this side because now it requires me to lean over the sterile field and you might bump it. See, like my badge right now is bumping the sterile field on accident, right? So I prefer to have it come this way so I'm not leaning over it. So swipe, trash, right? And you get a new one. Swipe on the other side, trash. And you get a new one, and then swipe once down the middle and then trash. If it was a male, similar, so we're going to switch to a penis, right? What you would do is if they are not circumcised and they have foreskin, you're going to have to pull that foreskin back so that you can visualize the urethra. You're going to hold the penis steady. You're going to do the same thing. You're going to use 3 cotton balls. You're going to do, instead of swipes, you're going to do circles, right? Because the penis is round. So you're going to do round in a circle, trash, grab another one, round in a circle, trash, grab another one, round in a circle, trash, going inner to outer, so you're moving the bacteria and whatever away from the opening, right? And then make sure at the end, after you've inserted everything, that you put the foreskin back. Don't leave it retracted because that can block off circulation. You need to pull it back for the cleansing and putting the catheter in, but please pull the foreskin back over after you're done. Anyways, let's go back to the vagina here, because vaginas are harder because there's several holes, whereas the penis only has one. Okay, so that's the cleansing of the perineum, and next we'll move on to the next section. One other thing you want to make sure you do as you're cleaning your patient is you want to do some patient education, right? Patient might not understand things about sterile procedures or the importance of, what the betadine is doing. They might feel embarrassed thinking like, oh man, this nurse is cleaning me because they think I'm dirty, right? They might not have any idea that it's a sterile procedure, what that even means, right? So I don't want a patient to feel like embarrassed that like I'm cleansing them because I think they're nasty. So I'm going to explain to them like, we're doing this because it's a sterile procedure, which is done for your protection, right? To disinfect the area of any potential bacteria or anything that could be introduced inside of your body to reduce the risk of infection. And we do it for everyone. And this is, emphasizing it's for their safety and that it's standard procedure, right? So they don't feel like it's singling them out. Okay, so next what we're going to do is to actually insert the catheter. Okay, so notice this whole time I've left this cover on here, right? And I like to just keep that on there as long as possible to keep it as clean as possible. Because especially if this whole process takes a long time, it'll be exposed to the air. Maybe people are breathing on it and getting all sorts of stuff on it. So I like to keep it covered until right when you're ready to put it in. So at this point, you have a couple of options. All right, usually you're going to have several helping hands when you're doing a Foley catheter. You're not going to want to do it by yourself, especially if it's a woman, because usually you need several hands. Men are a little bit easier, but also for your own protection, if anyone were to say anything like, oh, someone touched me inappropriately, you're going to want to have witnesses to support you. So having someone there with you for any type of Foley insertion is a good idea. So a couple options. You can either, this is your dirty hand, right? So I can't use this hand to touch anything. But I can ask a helping hand to be like, hey, can someone pull off this cover for me, right? So that I don't have to risk touching it with my dirty hand. You can also just leave it here and just pull it off like this, just making sure that you're not flailing this out. So if you pull it off too quick, it could go flailing around, right? So those are your options, asking someone to pull it off for you or pulling it off yourself. I like to just pull it off myself because I know my hand is clean. Just pulling it off gently. All right, then, putting that either down or putting it in the trash, whatever. Now, what I'm gonna do is stick the tip inside of the lube. right? So if I use the plunger and squirted it in the little opening, then I'm going to dip it where I had squirted that lube out, or if I had the packet, I'm just gonna stick it inside, right? It's a lot harder to try and like squeeze the lube out onto the tip like it's a ketchup packet or something. I just open it and kind of stick it in there and wiggle it around. Okay, so I have that, right? Again, you're only allowed to do this one-handed, so that's why you have everything all already pre-set up, so that you can just dip it, whatever. This hand is still here, right? So when you're ready, then you're going to make sure you, one thing that's helpful is to not try and hold it down here because it's really hard to steer. Holding it as close as you can to the tip so that you can really steer it well and it's not flopping. So I'm going to explain to the patient what I'm doing, right? Tell them that it shouldn't hurt, right? If it does hurt, to let us know. It's gonna be uncomfortable, but it shouldn't be painful, right? So I'm gonna start putting it in and advancing it. It's not gonna advance super far in this mannequin, but it's okay. So I'm advancing it until I see flashback. Flashback is the urine that starts coming out. Now that I know that I'm in the bladder because the urine's starting to flow. After I see flashback, I'm gonna advance another inch or two to make sure that the end is far enough up, because what we're gonna do now is going to inflate the balloon. The balloon is kind of like an anchor to keep it from falling out. So what I'm gonna do now is, after I've seen the flashback, I'm going to blow up the balloon by pressing in all of the saline. And you can notice what's happening is it's starting to get a bulge here, right? Normally you won't see that because it'll be inside the patient's bladder. But also watch, notice if I let go and put the syringe down, something's happening. I don't know if you can tell in the video or not, but the balloon is starting to deflate because just naturally the syringe, I'll try to pull it so you can see, is sucking the saline back out. So as soon, and you can see the balloon is much smaller than it was, and if you just keep letting it sit there, it's gonna deflate all the way. So what you gotta do is push the saline in, and then you have to pull the thing off so that it doesn't deflate. And now that it's in there, you can let go with your dirty hand and use this to pull off because the procedure is done, so you don't have to be sterile anymore. And as you're inflating the balloon, do it slowly and tell the patient, like, I'm going to be inflating the balloon. Please let me know if you feel any pain, because it could be perhaps in the wrong spot. It might not be far enough up. If they say they have pain, deflate the balloon, insert it maybe another inch, and then try again, right? So that we know that it's not still stuck in their urethra. Then what you're gonna do is like slightly pull back until you feel resistance, and that's when you know like it's lodged into place. Okay, so that's the insertion part. The sterile part is done, so you don't have to worry about maintaining sterile field anymore. You are now finished inserting the Foley catheter, so now what's left is just to do the completion. What I like to do now is get all my trash while I'm still wearing my gloves. So get all my trash, throw it away. You don't want to leave a bunch of trash like in the patient's bed or anything. Some nice ways to do it is like put trash in your hand and then take your glove off over the trash and throw it away. So I'm going to take these off. Take off my sterile gloves. You might want to put on some regular gloves now because you're still going to be touching the patient, touching things, but you can take off your sterile gloves. Now what you're going to do is secure the catheter tubing to the patient's thigh, because if you just leave it dangling like this, you know, like that weight pulling on this is going to be uncomfortable and pulling on that urethra, so that's going to be very uncomfortable. So putting like an anchor on that will help take off some of the pressure so it doesn't just hurt. So what you're going to get is one of these stickers. Looks like this. Open it up. It's going to look something like that. So you can see there's a hole there. That's where the tubing is going to go through. So this is a latch. Let's see if I can open it. There we go. So you see it looks like this, and it opens like this. This is where the catheter tubing is going to go through to secure it. So you're going to put it on the patient's thigh, like approximately right here. And so the catheter tubing will connect in here and latch on. So what it looks like is this. You're going to line it up so that it fits. So you'll notice that there's like, it's kind of shaped like a Y. There's a section for tubing there and a section for tubing there on both sides of this little notch. So you're going to line it up so that it fits, right? So it fits just like that. Then you're going to close it. And now, if there's any weight, it's going to, instead of pulling on the urethra, it'll pull on the sticker. right, and to protect the urethra. And on there, you might label, you know, your nurse initials, the time it was inserted, that sort of thing. So after you put the sticker on, you're gonna take the Foley bag, you're gonna hang it on the side of the bed, down below their waist, not on the side rails, because those things get moved around a lot, so like at the base of the bed. You're also gonna wanna educate the patient and explain to them why. A lot of patients, they don't understand. You'll often go into a patient's room and you'll find the Foley bag that's laying in the bed with them. But explain to them like, hey, like this only works through gravity. So if it's not hanging down, the urine isn't gonna flow, which means that it can back up into your bladder and, you know, cause bladder to overflow or a reflux into the kidneys, or just all that urine sitting in the bladder is a great opportunity for bacteria to grow. So educate the patient about why you're gonna keep the bag down there. And then you would want to make sure that when you go to do a nurse's note, you're gonna document important things. So you're gonna document the date, the time that it was done, make sure you use the words done using sterile procedure, right? Even though it's supposed to be one, you still wanna document that it was done sterile. You wanna name any of the people that were there with you, right? To protect yourself, right? Like, just in case any accusations were ever made, be like, present with Megan RN, Kate RN, or whoever they are. And then also you wanna document, you know, how much urine came out. So like if the bag filled up to like 300 mLs, you'd be like 300 mLs of clear yellow urine noted in Foley bag. And that is how you do a Foley catheter.